Good morning. I am Luciano Nardo. I'm the Clinical Director at Reproductive Health Group, which is a standalone state-of-the-art fertility and IVF clinic in Cheshire. Today, I will be answering some of the questions posed by prospective patients, and two colleagues of mine will be joining me in an attempt to answer all the queries with as much information as possible. First of all, let me just show you our sadness during this extraordinary unprecedented time that is causing significant delays for some patients to start treatment. I will pass on to my colleagues. Suzanne is our fertility nurse manager, and Karen Dickens is our care coordinator.
Well, we're currently trying to get as much done ahead of time as we can, so that by the time the clinic resumes the treatments again, we'll have most of the background information and things all done for you. So we're hoping to limit the waiting list, and would anticipate that we can try and get your treatment started as soon as possible without any further delays. Karen, what about yourself?
Yeah, we've currently got a list of patients waiting to start treatment, and we're confident with the preparation that we've done beforehand, such as consents, that we can, when we get the go-ahead to start treatment, we can start immediately or with very little delay.
Well, there could be lots of blood tests and things that you may have already had taken, or you may have already had a consultation. These are things that we can still look at and make plans for your treatment cycles. We can do the consenting process over Zoom, which that will save a lot of time at the other end. So as much preparation as we can do, we will do for you. All we need you to do is contact us, and we can get all these things in place, and then it'll just leave a small amount of remaining things when the clinic is ready to resume treatments again.
With regards to the consents and Zoom appointments, before this I will ask for copies of your passports, and that can be emailed to me. I'll then about a week later, the appointment will be booked for a week later. I will post out consent forms for you to have a look at, and then the week, and obviously the appointment, the Zoom appointment, you've had a week to look at the consent forms, and then when you're both available, the Zoom appointment will then happen with you, Suzanne. So that should help to move things forward without any delay.
Should, yeah. The reason we ask for passports is we have to do a form of identification first of all. So we'd ask that you email in your passports, but then when you do eventually come in to start treatment, we can verify those passports with your original passports, just to finalise the verification for the HFEA purposes.
There is no a date as yet when treatment will resume. Most of the professional societies in the UK, Europe and US have come up with the same statement that at the present time fertility treatment should be put on hold. The reason being that we do not want to create additional stress to already overwhelmed healthcare service. So we do not have a date when the treatment will restart, but certainly we will keep everyone informed. We will publish ongoing changes on our website. We could potentially perform collections under local anesthetic or even oral sedation, but this is not the point for putting the treatment on hold. We do not need an anesthetist all the time. However, the reason why we believe that treatment should not continue at this point in time is to be consistent with the advice given by professional bodies. We have got a strategy plan in place, and we have performed our last collections on Monday, 3rd of April, and we are completing the last few cycles before closing the lab for the foreseeable future. I appreciate that this is disappointing, and I appreciate this is not what some patients may want to hear, but I think we'll have to be a responsible approach from us as a clinic, and we have to be consistent with the general guidance provided by UK professional and regulatory bodies. Well, we are doing video consultations at the moment. We have established a secure online platform called Zoom, which enables myself and my colleagues within the clinic, as well as the nursing team and the patient services team and care coordinator, to keep in touch with the patient and provide as much information as possible, as well as support during this difficult time. We've been undertaking several remote consultations, and we will continue to do so in the weeks and months ahead. If you have had a remote consultation and everything has been clarified and the strategy plan has been put in place, and you have attended the clinic to have some screening tests, including hepatitis B, hepatitis C, HIV, syphilis, rubella, chlamydia, as well as blood tests for AMH, a transvaginal ultrasound scan, and if your partner requires a serum analysis, these have all been done, then you do not need to attend for a face-to-face consultation again prior to commencing treatment. The consents can also be signed remotely using our secure Zoom platform. So provided everything is in order and all the steps have been followed, once we resume the fertility treatment, then you can go straight into the treatment cycle after having contacted our nursing team on the first day of the period and having had a baseline ultrasound scan to confirm that the pelvic organs are in order.
Yes, absolutely. It's a good question. We're still supporting all our patients just now. The clinic is still physically open, although we are trying to do a lot of things online, but for viability scans, pregnancy blood tests and things, we are open for that, so we are here to support you. And once again, if in any doubt, just give us a call at the clinic.
I can arrange the ultrasound appointment from Monday to Saturday.
Yeah, that's true.
In the morning or afternoon, what availability we've got, so we can sort that out for a patient.
We've also spaced out our clinic appointments to enable patients to come into the clinic and for the clinic to not have any other patients in at the same time. So we're trying to reduce the flow of patients by widening the amount of appointments available.
There's usually a 15-minute gap between patients don't,
overlap,
keeping them as safe as possible.
I think at this point in time, while you're waiting at home, it's and we don't know what length of time this is going to be, obviously just trying to have a healthy diet, looking after yourself as much as you can, getting exercise if that's possible in the situation that we're currently in just now. Obviously reduce alcohol, not to be smoking, anything you can do that would be beneficial to having a pregnancy. The workup for a pregnancy would be good. Vitamin D and folic acid are good supplements to have too, but obviously a well-balanced diet. And also we have other services that Karen will maybe tell you about that you can access to, that if you're looking for some support or nutritional advice.
Yeah, we have a nutritionist who can give advice. We have a counsellor who can help to provide support. I say email me or call me and I can arrange appointments. as much as we can with this difficult situation that we're in at the moment. Try to relax as much as you can. If there's anything that would help, any forms of relaxation, to try to keep yourself as calm as possible, which will benefit you when the treatment can begin again.
And obviously we're here at the end of the phone just now, so please do get in contact with us. Let us know, and we can try and help you along this difficult journey at the moment.
Yeah, we're here.
Yeah, and just email us to at the info box.
Yeah, info@reproductivehealthgroup.co.uk, or my email kdickens@reproductivehealthgroup.co.uk, and we'll get straight back to you.
Yeah, we look forward to hearing from you and seeing you all again. Thank you.
Thank you.
The first consultation is a very important step of any medical visit. The first consultation is the time when the clinician will become familiar with the medical history, and will be an opportunity for the patient to share the past medical history, and as well as in the context of an IVF cycle, whether they have had any previous IVF attempts and understand why may not have been successful. We often ask that if patients have had previous IVF treatment cycles, then to bring copies of the past medical notes, as this will be an opportunity to review the laboratory as well as the clinical summaries. There is evidence to demonstrate that having a good knowledge of the underlying fertility problem helps to shorten the time to pregnancy and increase the chance of success in the forthcoming IVF cycle. So the first consultation at the Reproductive Health Group is very much the opportunity to start building together the fertility history and putting together a management plan. Often the first consultation is where all the tests have been organized, but in some cases another appointment may be required if the clinical and embryology team will be asked to review the past medical fertility and IVF notes. Before starting IVF treatment, a number of tests have to be organized, both for the female and male partner in case of an heterosexual couple, or for the female partner only if it's a single case of using donor insemination or donor IVF. We often present the patients with a cost plan, which is a detailed summary of all the costs that they will be facing from first consultation onwards up to completion of treatment. And that cost plan includes also the cost of the medications, as well as the cost of any freezing and storage and additional tests on the embryos, such as pre-implantation genetic testing. If a second consultation is required, that consultation can be taken place remotely, as very unlikely that there is need for a physical examination, but will just be a discussion to review some test results, as well as to confirm the management strategy. There are many factors that we know are affecting male fertility. But before discussing these factors, let me just advise you that knowing sperm count, motility, and morphology is just giving us an indication of the male sperm parameters, is not going to provide the reassurance that the sperm will be able to fertilize successfully the eggs. However, better is the quality of the sperm, easier will be the fertility treatment approach that we will offer, and we'll also be looking at conventional IVF rather than ICSI, and in some cases it's been shown that normal sperm will also be an indication for intrauterine insemination, provided the female history is normal. Normal sperm parameters can be modified by, or can stay the same, but abnormal can be modified by healthy living, by cutting down alcohol intake, smoking, regular physical exercise, as well as taking a combination of multivitamins and antioxidants. Knowing that the sperm has got a normal count, motility, and morphology, however, does not provide the reassurance that the DNA within the sperm cannot be potentially damaged. Hence why, in some cases, especially in IVF cycles where there's been failed fertilization or poor fertilization or poor embryo formation and development, we would recommend to do a sperm DNA fragmentation test. We also recommend to do a sperm DNA fragmentation test in cases of unexplained subfertility, as there may well be a problem with the DNA within the sperm that will affect the success of an IVF cycle, as well as being responsible for subfertility in natural cycles. This is a very interesting question, and one that we are often asked, given that probably 20% of patients attending a fertility clinic have got polycystic ovary syndrome. The most important thing for this patient population is to ensure that they have regular cycles, and if overweight, try to lose weight and go on to a nutrition program. It is important that women that have got polycystic ovary syndrome and an ovulation are investigated first to ensure that there are no other underlying problems, as sometimes there could be other causes of period irregularities that may not be identified until tests are performed. So we normally be checking for thyroid function test, we'll be checking for prolactin levels, as well as performing a full androgen profile. The aim is to restore normal cycles, and provided everything else has come back as normal, and provided there is a normal body mass index, then we would recommend ovulation induction with clomiphene first. In some cases, we may also advise to add metformin, and we would recommend also to take high-dose folic acid. AMH stands for anti-Mullerian hormone. This is a marker of ovarian reserve. It's far more accurate than the FSH, LH, and estradiol that have been measured for decades. And the reason why it's more accurate is because AMH is directly produced by the granulosa cells within the antral follicles. So it gives us an indication of the patient ovarian reserve at one point in time. A low AMH, in most cases, is associated with a lower chance of successful pregnancy. And that is because there will be less oocytes, although there's not a strict correlation between a lower number of oocytes and poorer quality. We have had in our clinic many patients that have conceived naturally, as well as by assisted conception, having a low AMH. So I would like to reassure women that have got reduced ovarian reserve, as shown by low AMH, that there is a chance to conceive naturally, and there is also a chance to conceive by assisted conception. It's not one size fits all, and in some cases within our clinic, women having a low AMH test will be enrolled in a multi-cycle, multi-stimulation program. There is no evidence at the moment that women that have got a low AMH will be at increased risk of miscarriage. simply because we cannot correlate low AMH with poor embryo quality. However, having low AMH and embarking IVF treatment in some cases may not be a very cost-effective approach. And in fact, within our clinic, some women that may have had failed IVF cycles having low AMH levels will be recommended actually not to embark on further IVF treatment cycle, because perhaps the overall chance of conception will be very much the same if embarking on IVF treatment as compared to trying to conceive naturally. I sincerely hope you found the answers provided by me and my colleagues, Suzanne Laughlin and Karen Dickens, useful. We are committed to provide patients with as much help and support as possible, especially during these extraordinary times. Our clinic in Cheshire is open every day, Monday to Saturday, and we carry out a number of services, both face-to-face in clinic, having adopted some stringent measures to reduce the risk of viral contamination, as well as by online platforms. If you have any questions, please do email us. The contact details and our clinic opening hours and services are available on our website. Thank you, and have a good day.